Basic anatomy. Clinical applications of anatomy. Anatomy is the basis for various medical interventions, such as surgery. Understanding anatomy guides doctors in avoiding damage to vital organs. Radiology. Knowledge of anatomy is used to analyze X-rays, CT scans, or MRIs. Anesthesiology. The anatomy of the nervous system is essential for procedures such as epidural blocks. Physiotherapy. The anatomy of muscles and joints is used to design restorative therapies. Clinical applications of anatomy refers to the use of anatomical knowledge for the purpose of diagnosing, treating, and treating patients in a medical context. The application of anatomy is essential in every aspect of medicine, from physical examinations, medical imaging, surgery, to other interventional procedures. Every medical practice relies on a solid understanding of the structure of the human body in order to perform appropriate and effective actions. Here are some of the main aspects of clinical applications of anatomy. 1. Physical examination. A physical examination is the initial process in diagnosing a patient's health problems, where doctors use knowledge of anatomy to thoroughly examine the patient's body. It involves visual observation and the techniques of palpation, percussion, and auscultation to assess the condition of the body and internal organs. Palpation. Touching the body to feel structures beneath the skin, such as organs or blood vessels. For example, a doctor might feel the abdomen for an enlarged liver or spleen. Auscultation. Listening to body sounds, such as heartbeats or breathing sounds, to detect abnormalities such as heart murmurs or wheezing in the lungs. Percussion. The technique of tapping the surface of the body to listen to the sounds produced. Used to assess the condition of internal organs, for example, to evaluate the size and condition of the lungs or liver. The application of anatomy helps doctors determine the location or abnormalities of certain organs based on knowledge of the position and structure of the body. 2. Medical imaging. Medical imaging is an important diagnostic tool that allows visualization of the internal structures of the body. In this case, an understanding of anatomy is essential to interpret images produced by imaging devices such as X-rays, CT scans, MRIs, or ultrasounds. X-rays, used to view bone structures, as well as detect abnormalities such as fractures or pneumonia. CT scans provide more detailed images of body sections, very useful in identifying internal organ abnormalities such as cancer or internal bleeding. MRI provides detailed images of soft tissues, such as the brain, muscles, or connective tissues. Very useful for assessing abnormalities in the nerves or brain. USG, ultrasonography, used to visualize internal organs, especially in the reproductive or cardiovascular systems, as well as to check the condition of the kidneys, liver, or blood vessels. An understanding of anatomy allows a physician to recognize normal body structures, as well as to recognize abnormalities or pathologies seen in medical images. 3. Surgery and surgical interventions. A knowledge of anatomy is the basis of all surgical procedures. Surgery requires a thorough understanding of the position of organs, blood vessels, nerves, and other structures to avoid organ damage or unwanted complications. Open surgery. In open surgery, an understanding of anatomy is essential in determining the proper incision points to access the organs or tissues involved. Minimally invasive surgery, laparoscopic, in this procedure, the surface anatomy and internal structures of the body are carefully studied to determine the best way to use small instruments through small incisions. Neurosurgery, for brain or spinal surgery. An understanding of the anatomy of the central and peripheral nerves is essential to avoid nerve injury that can lead to motor or sensory dysfunction. In addition, an understanding of anatomy also plays a role in other surgical techniques such as cutting blood vessels, inserting catheters, or organ transplantation. 4. Anesthesiology. Anesthesiologists use knowledge of anatomy to ensure that patients receive proper and safe anesthesia. They need to understand the location and pathways of nerves, as well as blood vessels that surround the area to be operated on, to avoid damage or unwanted reactions to the anesthetic. Regional anesthesia uses techniques such as nerve blocks to numb a specific part of the body, and an understanding of nerve anatomy is essential to targeting the correct nerves. General anesthesia requires an understanding of the airway, ventilation settings, and monitoring of other vitals during surgical procedures. 5. Treatment of organ diseases and disorders. An understanding of anatomy is used to design treatments for a variety of diseases that involve specific organs. Cardiovascular disease. Knowledge of the cardiovascular system is essential in the diagnosis and treatment of heart disorders such as heart failure, myocardial infarction, and hypertension. Physicians also need to understand the anatomy of blood vessels for procedures such as angioplasty or stent placement. Gastrointestinal disease, for the treatment of digestive disorders, such as Crohn's disease or colon cancer. An understanding of the anatomy of the digestive tract allows physicians to plan surgery or other therapies, as well as detect structural abnormalities in organs such as the liver, stomach, or intestines. Endocrine disease, for disorders of the thyroid, adrenal, or pancreas. A knowledge of anatomy is useful in understanding how medications or surgery may affect organ function. 6. Rehabilitation and physiotherapy. after an injury or surgery. Knowledge of anatomy is very useful in designing an effective rehabilitation program. Muscle and joint healing. Physiotherapists use musculoskeletal anatomy to plan exercises that can help patients restore strength and range of motion after an injury. Nerve healing. After a nerve injury, physiotherapists use the anatomy of the nerves and body tissues to design appropriate exercises or nerve stimulation to speed recovery. 7. Organ transplantation. Organ anatomy is essential in transplantation procedures to ensure proper matching and transfer of organs. Transplant surgery requires a thorough understanding of the relationships between organs and major blood vessels, as well as how to connect donor organs to recipients. Kidney transplantation requires an understanding of the anatomy of the urinary system to connect blood vessels and the urinary tract. Heart transplantation requires knowledge of cardiovascular anatomy to perform blood vessel reconnection and ensure optimal blood flow after transplantation. 8. Assisting in medical education. Anatomy also plays an important role in medical education. Medical students need to study anatomy in order to diagnose diseases and provide appropriate treatment. Therefore, a thorough understanding of human anatomy, both systemically and organ-specifically, is fundamental to the development of their clinical skills. Conclusion. The application of anatomy in clinical settings covers various important aspects of medical practice, from physical examination, medical imaging, surgery, anesthesiology, to rehabilitation. Every medical procedure requires a thorough understanding of the structure of the human body so that it can be performed properly and safely. By understanding anatomy, doctors and other medical personnel can provide accurate diagnoses, design effective treatments, and minimize risks during medical procedures.